Hello, guys. I hope you're all doing well. It's Ness Daniel once again, and today we are looking at the nurse's note. The nurse's note, yes. Have you ever came across a writing or a documentation like this? Patient alert and oriented. Report of 7/10 pain at the incision site, and the incision site is slightly red and warm to touch. Morphine 2 milligram IV administered for pain. Warm compresses applied to incision site. Performed wound assessment. Dressing was dry and intact. Patient educated on the importance of deep breathing exercises and cough techniques. Yes, so this is an example of a nurse's note. Yeah, and this is in a narrative form. A narrative form, yes. So today I just want to take you briefly into how to write a nurse's note because I know it's a problem. So before that, what is a nurse's note? What is a nurse's note? Yes, a nurse's note simply shows or states. So what it does is it states a patient complaints. It states the patient complaints and the necessary interventions that the nurse provided. So it's a written document that states patient complaints, feelings, emotions, physically, yes, and what intervention the nurse gave. So it's either written or an electronic document. Yes, if you have the LIMS or a software that you use at the hospital. So it's going to state the complaint. So just take note of this. It states the complaints of the patient, either physical, emotional, whatever, and the necessary intervention you gave. The necessary intervention you gave. Sorry. Yes. So why is the nurse's note important? Why is the nurse's note important? Okay. It is necessary for the continuity of care. So let's say you came for the morning shift. Yes. Once you write the nurse's notes, the person taking over from you, the person taking up from you can know what to do for the client or can ascertain what you've already done for the client and how he or she will continue with the care. So it's very crucial. Yeah, so whatever you do for the client, you document, you write, so that the nurses taken up from you would actually know to what extent the care you've provided to the client and how they will continue with theirs. Yes, so it helps with continuity of care. One, and the second one is legal protection. Legal protection. So, in an instance where there is a demise, where the patient passed away, or there is an issue, you can quickly get to your nurse's note. So, it's a legal document. It's a legal document. Yes. So, let's pay note or pay attention when we are writing our nurse's note. It's a legal document. It's a legal document. Yes. So, in case there is a demise, in case something occurs, yes, and the patient is no more or the patient is incapacitated, yes, we can go for this nurse's note, which can be used in the court of law, yes, so that whatever the issue is, you might be free. You might be free from those accusations because you documented, you did a proper documentation. Please, I hope you are following. Yes. So we are stating the complaints, what the patient is telling you, the emotional, physical, yes, and we are providing necessary interventions. Yes, and it allows for continuity of care and it's a legal protection. Yes, it's a legal document. Yes. Okay. And lastly is patient safety. Patient safety. Yes. So it helps with patient safety. Let's say um, the patient has certain issues with certain family members. Yes. So he or she doesn't want them to visit. So if you have this knowledge in mind, you will know what to do. You will know what to do in protecting your clients from those people. Yes, in protecting your client from those people. And if your client has certain allergies, you may document or you must document in the nurse's note, which will also help the client. Yes, so that we do not give a medication that will cause the allergies, that will exacerbate the allergies. I hope you are following. Yes, so it helps with patient safety regards to medications, allergies, and certain unwanted nuisance from certain people. Yes, let's say they are married and the husband is maltreating the wife, and the wife doesn't want to see the husband. In that instance, you know how to go about certain things. Yes, so it also helps with patient safety. So these three things are very essential. So they are the reasons why the nurse's note is very important. You don't play with it. Yes, don't play with it. So now let's look at some key principles of nursing documentation. Yes, since it's a legal document, yes, there are things, necessary things that we have to put in place that will aid in the legibility of our documentation. Yes, so let's look at the first one. So the first one is accurate or accuracy. Yes. So your nursing your nurse's note, should be accurate. Yes. Any information that you give must be factual. Yes, and it should be based on your observations, a direct observation. Yes. So it is factual. There are no assumptions. So you make sure there are no assumptions. So it has to be factual, it has to be a direct observation, and there should be no assumptions. Yes, because it's a legal document. It's a legal document. Yes. Okay. The next principle is that it should be very complete. It should be complete. It should be complete. There should be no room for loopholes. You shouldn't leave out any vital information. So don't leave vital information. So don't leave out any vital information. Yes. So it should be very complete. Complete everything. Yes. Before handing over. Yes. So any relevant detail should be there. Okay. The third one is it should be clear and concise. It should be very clear and concise. So you have to use simple language, simple, direct language. Avoid jargons or abbreviations that are not universally understood. Yeah, so it should be very clear, concise, avoid jargons. And if you use them, if you use any abbreviation, it should be that which is universally accepted. Yes. Let's move on to the fourth one. Let's be quick with this one. It should be timely. It should be timely. It should be timely. So make sure you input the exact time you carried out any intervention, the exact time you wrote the nurse's note. Yes, so it should be timely. It should be timely. It should um, have the various times. Yes, the various times that you provided the necessary intervention for the patient. Okay. Let's move on to the fifth one. The fifth principle is that it should be organized. It should be organized. Yes, it should be organized using a logical structure. Yes, it should be organized. When we read it, we should see a certain level of organization. Yes, the words are together. The words are together. Yes, so the sixth principle is that it should be legible. In case your hospital is still using paper and pen, yes, it should be very legible. It should be very legible that we can read. That we can read, yes. And even if it's electronic, yes, you should increase font sizes. Yes, you should increase the font size, and this can help. And this can help in terms of our continuity of care, in terms of any legal protection, yes, and patient safety, yes. Okay, so let's look at the final one. The final one that we should consider a principle is that it should be professional. It should be professional. Don't use any language that states otherwise. So the tone, the tonation should be very professional. Should be very professional. It doesn't matter how fond you are with a patient. No, it should be a professional tone. The tonation should be professional. Yes. And other principles are there, like confidentiality. It should be very confidential. Yes, you should maintain the patient privacy. So these are the principles. These are the principles to consider, or these are the principles that governs writing a nurse's notes. It should be accurate, stating facts. It should be complete. It should be clear and concise. It should be timely, organized, legible, and professional. Yes, and professional. So these are the principles that governs writing a nurse's note. Now let's move on to some formats. So today we'll be looking at the SOAP format. So there are actually different formats. Three different formats that the nurse's note normally takes. So today we are looking at the SOAP format. Yes. Before we dive straight into the SOAP format, let me just say this. Nurse's notes is very easy. Yes, recently I had a nursing student contacting me to write a nurse's note for her. Yes, and I was very surprised because it's just about the timing, the dates, and some necessary information, some data from the patient that you need, and the necessary interventions that you provided. Yeah, so it shouldn't be much of an issue or much of a problem. Yeah, so I was just very shocked and very surprised. Yeah, so let's look at this format, the SOAP format, and let's dive straight. Let's dive straight into our nurse's note. So, what does the SOAP format state? Okay, so the S stands for subjective. The S stands for subjective. Okay, so we all know subjective. Subjective means what the client is telling you or what the patient is telling you, their feelings, their symptoms, their contents, relevant history, just as my preceding presentation stated. Yes, maybe he has histories, he has allergies, there are some grudges in the family, he doesn't want any particular family member to be around. Yes, so these are the subjective details the client gives you. Okay, the O stands for objective, and objectives simply means what you observe and measure. Yes, so the vital signs, the physical examinations, the lab results, anything observable with the client. Yes, And A stands for assessment. So after looking out for what to measure and any observable behavior with the client, you move on to assessment. Yes, and the assessment simply means your interpretation of the subjective and objective data. Yes, and this might be your nursing diagnosis, your problem, and how to achieve the goals. Yes. So in assessment, you are looking at interpretation. Okay, let's say you've measured the vital signs. What are the signs, or what are the readings giving you? What are the readings trying to imply? Yes, so this is the stage. Yes, that's the assessment stage. Yes, so the subjective and the objective data, what are these data implying? Yes, that would be your assessment. And the last one is the plan of action. So what to do based on your assessment. So here it's more like an intervention. It's more like an intervention. Yes, it's more like an intervention. So you have a subjective data, an objective data, an assessment, and what to do next, which is your plan. Okay, so let's look at an example. Sorry, let's look at an example of the subjective part. Okay, you get to the client, and the client is saying, I couldn't sleep. So the client couldn't sleep. Okay, I have pain at the incisional site. Okay, I have pain at the incisional site. Okay, and the pain gets worse when I cough. The pain gets worse when I cough. So these are the necessary, or these are the details the client is giving you. So the client is telling you that he or she cannot sleep, and there is pain at the incisional site that seems never ending. And also, it gets worse when the client is coughing. Yes. So, this is what the patient is telling you. Okay. Now, your objective data. Let me try and rule a line. Your objective data or your objective finding. Okay. So, since there is pain, you need to assess the pain. Yes. You need a certain measure. Okay, so you ask the patient on a scale of, let's say, 0 to 10 or 1 to 10, what is your level of pain? The client will tell you maybe 7/10 pain at the incisional site. Then you might want to touch the incisional site to assess, yes, the wound. So you do a wound assessment. Okay, so let me write wound assessment. And maybe you might find out that the wound is reddened and probably warm. Yes. And per assessment, maybe there are discharges or there are no discharges, depending on what you see. Yes. And from that, you can move on to vital signs. Vital signs. And all these are providing you with a certain objectivity, your own objective data. So you're the vital signs, temperature, heart rate, respiratory rate, blood pressure, the RBS. All these will provide an idea, yes, an idea or a certain measure of what the client is going through. Yes. So after all these, you move on to the A part, the assessment part. So based on these findings, just as I stated in whilst presenting this video, that you can write a nursing diagnosis here. a nursing diagnosis. So based on this, you can write either acute pain or chronic pain related to incision at the lower, or let's say surgical incision at the lower abdomen. Yes. So at this point, based on your subjective objective data, what are those readings giving you as a nurse? What is your nursing diagnosis? So you state acute pain or chronic pain related to surgical incision at the lower abdomen. By now, you should know how to write a care plan. Yes. And a nursing diagnosis. Yes. If you don't know, I have a video on that. You can quickly check. Yes. So you write this, then you move on. Okay. And since there was redness and warmness, another nursing diagnosis could be potential for infection at the incisional site. So risk for infection. At the incisional site. Risk for infection at the incisional site. Okay. So your next plan of action, which is the P, will be what you did, your interventions. Yes. Since there is pain, there's a high probability of administering some drugs. So you administer analgesics. Yes, so you might want to administer some analgesics. Yes, so either morphine, yes, etc. Yes. Here you state the exact dosage and the exact route. Yes. So let me state it properly. So prescribed analgesic. Then you say the analgesic IV morphine. IV morphine 500 milligram administered. Sorry. Administered. Okay. After that, what else did you do? What other interventions? Okay. Let's say you applied a warm compress at the incisional site. You applied a warm compress at the incisional site. Yes. And you also encourage the client to cough. When coughing, should splint the wound. Yes. So deep breath with splinting. Yes. So all these, you can add this. So deep breath with splinting. Yes. So this is the SOAP format. The subjective, objective, assessment, and plan of intervention. Yes. Sorry for separating them, but mostly we write them together. I just wanted you to get the picture. Yes, the picture of what you are doing. So you start by asking the client. I'm just trying to do a recap, a very short one. You start by asking the client, what are your complaints? What is troubling you? The client will give you something, pain, whatever. Then you straight ahead, you move on to your vital signs. And if there is pain, you do the pain assessment using whatever skill that you know. Then you move on to a physical examination. Yes, so you move on to any physical examination. you touching the site, palpation, auscultation, percussion, whatever, are the objective part to get you an objective view of what is happening to the client. Yes. Then you move on based on these two data, subjective, objective. What is it trying to tell you? You write a nursing diagnosis. Yes. Then you move on. Once you have a nursing diagnosis, intervention becomes easier. So you move on with your plan. Yes. You administer whatever medication, whatever other nursing reliefs or nursing interventions that you can give to the client. Yes. So basically, this is one of the three formats, the SOAP format. Sorry for the instability of the camera. Yes. So this is one of them, the SOAP. Yes. In my next video, we will look at the other two. We will look at the other two and we will summarize. Yes. So this has been the nurse's note. The nurse's note. And when we started, we said you can write it in a narrative form, as if you are narrating or you are telling a story. Yes, we will look at that in my next video. Yes, I hope you got an understanding of how nurses notes, of how we write a nurse's note. Yes, and thank you for watching. And this has been Daniel. See you later. Bye.